Hello, my name is Zha-nee Johnson. I am performing a newborn exam for Pediatrics Midwifery 2050. For this exam, I will be using the MCU Midwifery Skills Guide, the most updated version, to help with assessment. Okay, so let's begin. I did wash my hands off of the camera using aseptic technique. Um, Hi, parents. We're just going to conduct your baby girl's newborn exam, and we're just assessing and kind of seeing if your baby maybe needs more hands-on requirement, or if we're going to have to transfer out of care. And I'll talk through the process with you to let you know what I'm seeing, as well as going over it. Is that fine? So I would like to just get some numbers on her first, just to check her head circumference, check her length and height and all of that good stuff. So I'm just going to check her head first. Her head circumference, all this beautiful hair. She's about 13 for head. It is about 8 for chest and 8 inches for chest, and then her length is about 10. Perfect, 10 inches. She's exactly where we need to see. So your baby is laying, of course, all wrapped up and bundled as much as we can. So I'm just gonna look over her normal appearance in general, just to see if I see anything that sticks out to me. I'm looking for if she has any signs of jaundice, so like yellowing in the eyes, yellowing mucus in her mouth. I don't see that at all. I'm looking for birthmarks, any vernix, any lanugo, any hair on her little body. I'm looking for peeling, any lesions and stuff like that, and overall just how she's doing, how she's breathing. She looks wonderful so far. In this exam so far. So first thing we're going to do is just check her head for molding. So I'm just going to check over all of the different parts of her body. And what I'm looking for is to fill 2 of her fontanelles. So the one in the front, which is present, and the one in the back, which is present. I'm checking to see if I see any molding, which I don't expect to because you pushed her out like a champ. I'm checking to see if I'm having if there's any hematomas. And her hair pattern again is just so gorgeous and nice and full of hair. You did a really good job. So now I'm just observing her face. I'm looking for symmetrical in shape. I'm looking for, I guess, movement overall. I'm looking to see if her eyes and her ears are symmetrical on both sides, and they are. I am looking for the spacing in between her eyes. Let me measure that out. That's about 2 centimeters. I'm looking for red eye reflex. In this scenario, my phone will be the pen. So I'm just looking at her eyes to see if she's having that red eye reflex in both eyes. I'm looking to see, is she following the light? Is it the pupils reactive? She is. Perfect. I am again examining her ears and the shape and sound, the reflex of it, and how it shapes back, which looks normal. I'm looking at observing the shape of that nose. It is patent, both airways, so nice and open. Nasal airways, nice and open. So now we're moving down to her mouth. I am checking for the Rudin reflex, so I'm going to take my pinky, rub it along her jaw. You see her mouth is kind of opening. Good, that's the root reflex. Next, again, as I mentioned, I did wash my hands. I'm just going to put my pinky in here to check that sucking reflex. Oh, she has a good suck going on. Perfect. Next, I'm just observing her lips, her tongue, her mouth, which looks appropriate for her in that frenulum area, that little divot right here, perfect and normal. Next, I'm going to move down for her neck. I'm just checking her neck for any masses. I'm looking at her range of motion. Oh, hi. Good job on turning your neck. Oh, yeah, she's doing really good. Next, I'm going to check for clavicles. Again, I'm not expecting it not to be intact because she slid on right out. Her clavicles are intact, which is amazing. Now I'm checking her chest, looking at it. I'm looking at the symmetrical. It is symmetrical. I'm looking at her rib cages to see if there's any retractions or grunting. I'm not observing that at this time, which is amazing. Next, we are going to look at her hands and her arms. I'm just looking at the normal parent, seeing if anything looks like it's broken or hurt or sore. At this moment, I don't see any. I'm looking at the nail length, which is about the same size as her fingertips. Perfect. I'm looking at the digits. She has 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Perfect. 5 fingers on each hand. I'm looking at those palm creases. She does have about 2, which is normal. I am going to put my finger in her hand to see if she grasps it. And she does, which is normal and what we like to see in that grasp reflex. Next, I am going to listen to her lungs. Right now, I'm just checking to see if there's any railing, is there cracks and sounds. I do not have a stethoscope at this time, so I'm using this measuring tape for it. So I'm going to check in 6 different places, in front and back. Perfect, no cracks or rills or any sounds of struggle or distress observed. Now I am listening to that respiratory rate. I'm going to listen to a full minute for this. Perfect. Respiratory rate is about 45, which is within range of normal. Next, I am looking for the heart rate. So I'm going to check for valves with the heart rate. It's starting down low. Apple. So good. I didn't hear any murmurs or any skips in it. Heart rate is about 132, again, which is normal. Next, I am listening for bowel sounds in 4 of the quadrants. Perfect. Now I'm just going to palpate the stomach for any masses. No masses found. Perfect. We did cut her cord earlier. She did have 3 vessels, 2 arteries, 1 vein, which we like to see. Now I'm just going to check her femoral pulses. That is intact. I am now going to check her hips for cracks and pops and anything in here. I'm going to push it back like a frog. Perfect. I don't see anything with the Barlow maneuver. And I don't see any with the Olani maneuver. Perfect. Next, since her legs are up, I'm just going to observe, with your permission, Mom and Dad, her genitals. Perfect. Her majora covers her minora. Now I'm looking at plantar reflexes. She has that. And her Babinski, she has that as well. Now her anus is patented and her spine is perfectly intact. I am checking for that startle Monroe reflexes and is symmetrical. She does have both. Baby looks perfect right now. Did you have any questions for me? Okay, thank you.